country. I will be brief. I will not try to follow what you just heard. I grew up Baptist, but my church was a little different. But stay with me for a few minutes. This guy thought he did better. But stay with me for a few minutes. I know many of you. Look at some very familiar faces. I came to Columbus about a year and 2 months ago. And I think some of you knocked on doors and made phone calls and hosted meetings in your house, from Chillicothe to Toledo to Cleveland to Cincinnati to Butler County, all across the state where people said we couldn't do it. People said there's no way that in the state of Ohio are we going to elect Barack Obama president. But you showed us something different. And on November 4th, I stood, yes you did. I sat about, I don't know, 5 minutes from here in a boiler room, watching results come in, watching your work, watching votes come in of people you talked to, of people that you registered, of people who didn't think they were going to vote when you turned out. You have a lot to be proud of. We would not be standing here today if it wasn't for you. Packed it all up and come back from 2011, maybe 2012. The president could have gone to Washington and done what a lot of politicians do and not done much, and try to get reelected. But you fought for change in hot rooms like this, and in cold, bitter winter nights, when no one thought we could do it, because you wanted to see real change. And so we started organizing for America on November 5th, basically, in order to bring people together to create real change, to get this done. And so let's talk a little bit about what you've been doing, and I'll be brief. Oh, we kicked off our health insurance reform campaign on June 6th. That's right. Before all the Johnny-come-latelys came out, realizing there was a health insurance fight going on, you were out there knocking on doors. You were calling your neighbors. You see names on the screens right next to you. They represent Ohioans who you signed up to support the president's health insurance principles. At their doors, on the phone, in public meetings, because we know a little thing about how to win elections, and we know a little thing about how to win on important issues. You proved it in November, and we're proving it again in 2009. Yeah. I like numbers, and so do you. Since that time, 12 weeks ago, we've hosted over 14, by Tuesday, we'll host over 14,000 local events. Just like this. 14,000 in every single state, in every single congressional district. So don't let the 24-hour cable news echo chamber tell you something that's not true, because the biggest myth of this summer is that those opposed to health insurance reform, those supporting the status quo, just like Senator Brown talked about, that they've outnumbered you because they haven't. They haven't. And when Sherrod Brown goes back to Washington, and Representative Kilroy goes back to Washington, they're going to be remembering your faces. They're going to be remembering what you did. 1.5 million of you, 1.5 million in the last 12 weeks, decided that you weren't going to sit on your couch, that you were going to pick up a clipboard, and you were going to walk the game. That you were going to pick up a pen, or better yet, use your computer and write a letter to the editor, or to your grandmother, or to your friend, or somebody who you thought was undecided. And that work is the reason that we're standing right now on the brink of change. Change that will protect and promote your choice. If you are one of the 46 million Americans without health insurance, you're going to have a choice, including a robust public option. Change is going to mean ending unfair insurance industry practices and providing all of us with basic protections. Yeah. We can get this done. Yeah. Yes, we can. Change means that insurance industries will be prohibited from denying coverage based on pre-existing conditions, from dropping your coverage when you get sick, or from capping the amount of coverage you can receive. We can get this done. Change means limits to the amount your insurance company can charge you for out-of-pocket expenses, for things like deductibles and co-pays, and require insurance plans to fully cover preventative care. We can't get this done. Right now, the system works better for insurance companies than it does for us. And that's going to change. My friends, it was a pleasure to fight with you in the hills of Appalachia and in the cities of Columbus and Cleveland. And it has been a pleasure to fight with you these last months. And when you leave here, we need you. It's not enough to come here tonight. It is not enough. We need you to go right now to BarackObama.com when you get home. If you haven't already, you can go on there and call your neighbor. You can go on there and write a letter. You can go on there and get all the information to fight back. But do not leave here thinking anything but we stand. We continue to stand on the brink of one of the most historic changes in our country's history. We got here today because of you, and we are going to bring it home and get it done because of the people in this room. Let's get it